In-person versus telehealth for concussion clinical care in adolescents. So obviously with COVID, everything switched to telemedicine. Now, this was a pilot study, but not looking at necessarily the effectiveness, but simply how well of a relationship could be formed, the therapeutic alliance, and how patients were either satisfied or dissatisfied with their concussion care, virtual versus in person. All right. So there was 15 patients that were randomly assigned to in person, and 15 patients with a concussion were randomly assigned to a telehealth clinical visit. The therapeutic alliance scores were not significantly different for patients in the in-person or telehealth setting. Caregiver therapeutic alliance scores were significantly higher for in-person. So it seemed like the parents of these adolescents really preferred to be in person versus virtually, but the patients themselves found it just as equally beneficial. No significant differences between in-person and telehealth sessions. Satisfaction scores for patients on depth, smoothness, positivity, arousal, or good or bad outcomes. Patient and caregiver satisfaction with the clinical setting was high. Basically, they thought it was okay. So conclusion, telehealth is feasible for assessing and interpreting clinical concussion examination, interview, and neurocognitive findings, which are perceived by patients and their caregivers to be comparable with in-person care.